We turn now to a growing health crisis. Mississippi has declared a public health emergency over the state's rising infant mortality rate, which last year reached the highest level since 2013. CBS News medical contributor Dr. Celine Gounder joins me now. So, Dr. Gounder, what's behind this crisis?
It's a combination of healthcare access as well as various different social challenges. So more than half of the counties in Mississippi don't have a single hospital with a labor and delivery ward or an OBGYN to deliver a baby. That means that women have to travel that much farther to access care. Poverty is also a really big factor in Mississippi. Nearly 1 in 5 people in Mississippi live in poverty or below the poverty line. And Black babies in particular in the state are dying at twice the rate of white babies, which shows that some of these healthcare disparities continue to play a role in the state.
And what's the state doing about this now that this emergency has been declared?
Well, one of the things they're doing is trying to expand prenatal services in areas that don't have the obstetric care. So they're setting up a statewide system to make sure that people are transferred promptly to the hospitals with the right level of care, and also trying to institute home visiting programs to help women ahead of pregnancy manage their health issues.
Right, because of those long distances, you don't get the checkups along the way. That makes the ultimate pregnancy that much more challenging. So what other kinds of things could a state facing these kinds of challenges do to make the situation better?
Well, the biggest predictor of maternal issues, whether it's her own health or the baby's health, is what was her health going into the pregnancy. And what is the best way to manage your health going into a pregnancy? It's to have access to health care ahead of time, right? And when you're talking about a state where 6 in 10 births are covered by Medicaid, you have an extremely significant proportion of the population that's below the poverty line, not waiting until somebody gets pregnant to start them on health insurance, but having health insurance, Medicaid ahead of time, where you can start to address your issues, high blood pressure, diabetes, obesity, et cetera. That's what would make the biggest difference.